Hi, I'm Catherine from East Haldimand Hospice. Welcome to East Haldimand Hospice series of educational videos for caregivers, Walking in My Shoes. Topic 12, How to Help with Physical Needs. Physical needs can include loss of appetite and nutritional needs, shortness of breath, body odor, skin breakdown or pressure sores, changes in appearance, incontinence, constipation, unable to get out of bed to make the bed, moving from bed to chair, mouth problems, and confusion. Loss of appetite and nutritional needs. What you can expect. The body isn't digesting food as it once did. The person's metabolism may be slowing down, and a decreased appetite will therefore be normal. The person may refuse solids altogether and prefer only liquids. Weight loss may occur no matter how much is eaten. A changing sense of taste, including making some foods taste too bitter or too sweet, will also alter a person's appetite. Certain food textures and certain food smells may cause nausea. The need for liquids will also decrease towards the end of life. This is normal. Forcing food or fluids can lead to distress, choking, or aspiration, which means inhaling food or fluid into the lungs. So, how can you help with changes in appetite? It is perfectly fine if the person doesn't want to eat as long as they continue to drink fluids, although at some point swallowing liquids may become difficult. Try adding fruit and juice to milkshakes or smoothies. Avoid giving orange, pineapple, or tomato juice on its own, as these juices can aggravate mouth ulcers or cause indigestion. Try serving water, tea, or soft drinks to take a strange taste away. Sometimes adding lemon juice to foods can make food taste more normal. Try new spices and flavors for food to avoid salty or too seasoned foods. Add sauces or gravies and experiment with adding a little sugar, basil, lemon juice, or mint. Marinate meat in soy sauce, sweet juices, or sweet wines. For people who do not want meat, try high-protein foods like eggs, chicken, or fish. Choose foods that are soft and easy to eat. Smaller portions, served 5 or 6 times a day, or when the person requests, may be more palatable than a full meal. Only offer what a person feels like eating. Sometimes a glass of beer or wine, if permitted by the doctor, will stimulate appetite. Offer cold plates of cottage cheese and fruit if the smell or food is a problem. Nutritional supplements can be found at the pharmacy. Don't worry that a person is starving or thirsty. The body has learned to shut down and prepare for the end and eliminates the need for fluids and food naturally. Shortness of breath and breathing difficulties. Breathing problems can be very frightening for caregivers. Anxiety can cause shortness of breath. Shortness of breath can cause anxiety. Call the doctor when a sudden onset of breathing difficulties occurs. Sign that a person is experiencing breathing difficulties. Depth of breathing changes. Rate of breathing changes. Breathing becomes more irregular. A blue tinge appears around the mouth and nail beds. Thick mucus can't be coughed up. And breathing sounds moist and gurgling. So, how can you help with breathing difficulties? The goal is to make the person comfortable and minimize their feelings of distress. Plan for frequent rest periods between events where some exertion is needed. Remain close by, be calm, and coach the person into relaxing and breathing more slowly. Create a breeze by opening a window or using a fan. Avoid fragrances or scented products which can trigger a coughing or sneezing attack or cause shortness of breath. Use a humidifier to moisten the air and loosen secretions so a person can cough them up. Serve warm drinks with lemon and honey to reduce mucus. Reposition the person by having them sit up with arms over a pillow or a bed table, or elevate the head of bed to raise the upper body. Loosen clothing and bedding. If secretions cannot be cleared with a mouth swab, then ask the doctor for a medication that will dry up the secretions. A cold compress placed on the forehead or cheeks will help to lessen the feeling of breathlessness. Now, managing oxygen therapy. Be careful. Any spark could ignite a flame or explosion. Do not use Vaseline, as it contains petroleum, which is flammable. Be sure that the face mask is properly adjusted and is in the correct position. Turn oxygen off when not in use. If the tubing is reddening the skin, use a self-adhesive padding under the tubing. Oxygen is not recommended at the end of life unless the person has used it throughout their illness. If so, it can provide comfort. If the tubing is irritating the back of the ears, talk to your oxygen provider about ear protectors. Next, body odor problems. If the body is dealing with a serious health condition and the body's liver and/or kidneys are struggling to process toxins, then a body odor may result. In those cases, no amount of personal hygiene will take away the smell. Similarly, diabetes creates a condition called ketoacidosis, which gives the breath a fruity smell and can cause a distinct body odor. If the person is diabetic, consider it a medical emergency and call for help immediately. However, if someone is dying naturally, there is no need to call 911. Caregivers may need to wear a mask to help cope with the strong smells. However, doing so may upset the person. Instead, try one of these easy ways to mask odors. Place coffee grounds in the room. Place a bowl of baking soda in the room. Use an essential oil diffuser. Open the window and let some fresh air in. Ensure that the person receives frequent skin and oral care and clean bedding as often as needed. Aromatherapy. Aromatherapy is the use of essential oils of plants by inhalation using a diffuser or by applying to the skin. It may be helpful to promote relaxation, to alleviate anxiety, to reduce depression, to reduce pain, to reduce nausea, to alleviate physical symptoms, to alleviate side effects of chemotherapy, to improve sleep patterns, to reduce stress and tension, to alleviate psychological distress, provide emotional support, to improve well-being and quality of life, and to live with altered body image. Ask at your local pharmacy where you could purchase essential oils and a diffuser. Skin breakdown or pressure sores. When you see red, tender skin over pressure points or in skin folds, dry, itchy skin, rashes, open, weeping sores, or tears in the skin, then you know that skin is breaking down. Skin problems and skin breakdown can occur for a number of reasons, including immobility, decreased nutritional intake, changes in metabolism and lack of repositioning, sliding on the sheets, which can cause tiny skin tears, making people predisposed to infection, old age, which can lead to thin, fragile skin that is easily torn, lack of oxygen to the tissue at pressure points leading to pressure sores, yeast infections such as thrust in the groin area or under the breasts. In order to help with skin difficulties, establish a schedule so you can remember to reposition the person every 1 to 2 hours by lifting them with a turn sheet or slider sheet. Add a foam pad on top of the mattress. Use pillows or sheets to pad bony prominences. Put a pillow between the knees and ankles when the person is lying on their side. Gently massage hips, heels, and the person's tailbone with a moisturizing lotion. Keep all linen wrinkle-free and dry. Give a gentle bed bath. Use flannel towels as they are softer than terry cloth towels. Wear gloves so your own rough skin isn't hurting the person, and report skin changes to healthcare providers. Next, changes in appearance. Swelling is caused by extra fluid in the tissues or abdomen, which will cause feet, lower legs, and hands to swell. To help with swelling, elevate the feet when the person is sitting in a chair or lying in bed. Massage the swollen areas to help fluid to be absorbed. So how can you help with muscle loss? Well, loss of muscle strength can occur as a result of illness and/or from prolonged time spent in bed, which will require that you provide extra help with walking, dressing, and getting in and out of bed. Reassure the person that you don't mind helping them. Recognize that the person may feel frustrated at how weak and tired they feel. Use a bell or baby monitor so you can come quickly if needed, and rent a walker or wheelchair if needed. Next, incontinence. Loss of control of the bowel and bladder is so common that there are several products on the market now that can help. Incontinence garments like Stay Free, Dry Plus, Attends, Poise will help keep sheets clean and dry. Change the garment often. You can use a zinc oxide cream to help prevent sore skin. Be sure to wear gloves or wash your hands with warm soapy water each time you assist with incontinence garments. Constipation. Constipation is caused by not drinking enough, not eating enough, and not eating enough fiber or getting enough physical exercise. And so the gut is slowed down due to opioid-based pain medication. To help with constipation difficulties, note that most of these suggestions are inappropriate in the final days of a person's life. Have the person drink several 8 to 10 glasses of water each day. However, at the end of life, this intake becomes unrealistic and could cause distress. Often people only take a half a cup per day in the final days of life. Gradually add more whole grains to the diet. Offer a hot drink in the morning. Encourage walking and exercising in bed. Avoid chocolate, cheese, and eggs. Monitor bowel movements and observe for abdominal swelling and pain due to constipation. Have a nurse give a suppository. Mouth problems. Mouth problems can have several causes, including dehydration, fungal infections such as thrush, which is bad breath, white patches on the tongue, sore mouth, and throat. Thrush can spread to others, so avoid kissing the person on the lips or sharing utensils if you suspect thrush. Open sores, cracked lips, poor fitting dentures, and decaying teeth. Keep the mouth clean and moist. Remove dentures before cleaning the mouth and clean the dentures using a denture cleaning product. The doctor may prescribe a medicated cream to rub on the gums under dentures. Treat cracked, dry lips. Provide frequent sips of water as tolerated or use a spray bottle. Provide oral care as frequently as every 2 hours and certainly after waking, after each meal, and at bedtime. Have the doctor prescribe a medication that is swished in the mouth when then swallowed if needed for thrush. Use an alcohol-free, gentle mouthwash. Comfort measures for thrush infections may include medication obtained from a healthcare provider such as mycostatin. Clean the mouth by rinsing with mouthwash or plain water after eating. White patches can be gently removed with a soft toothbrush when they become loose. Soak dentures overnight in full-strength Listerine, rinsing before they are put back in the mouth. Signs that mouth care is helping. The mucous membranes are pink and moist, mouth is clean, thrush patches decrease in size and number, and the mouth discomfort subsides. Here are some easy recipes for mouthwash to make at home. 4 cups of water plus 1 teaspoon of baking soda and a teaspoon of salt. Or 1 ounce of ginger ale and 2 teaspoons of baking soda. Or cedar greenery and boiling water. Next, confusion. Confusion may start slowly and progressively, worsening, leading to short-term memory loss, poor concentration, decision-making difficulties, seeing and hearing things at night that aren't happening. Similarly, the person may demonstrate anger and become fearful for no obvious reasons. How to deal with confusion. Start with them and where they are at. Remind the person who you are frequently. While talking to the person, position yourself so that you are face to face, turning off the background noise from the television or radio. Keep the calendar and clock in view of the person so that they can feel orientated. Do not leave the person alone for prolonged periods of time. Talk slowly and quietly using short statements. Be sure to keep the medication out of reach and bring it to the person yourself rather than having the person self-administer their own medication. Confusion can occur very suddenly or can become worse. The person can become violent or agitated. This is when you need to ask for help. This concludes our topic 12, how to help with physical needs. This video has been made possible due to the generous grant provided under the Resilient Communities Fund of the Ontario Trillium Foundation.